The topic of what we want to review today is bruxism.
There's an important interface between dentistry and sleep medicine. Examining the teeth and looking at tooth wear patterns are important because that may relate to sleep bruxism, which has been related to sleep apnea. Why is someone destroying their teeth in their sleep? And we've come to realize it's because they're trying to protect their airway. With bruxing, they're stabilizing the mandible forward, which brings the soft tissue, such as the tongue, forward. It helps keep the airway open. There are a lot of people that will also tongue thrust. Kids will tongue thrust to overcome their obstruction. Sucking the fingers of the child also helps keep the airway open.
Non-nutritive sucking habits is a sign of airway obstruction or tongue tie. So we need to actually treat the airway obstruction, the tongue tie, the myofunctional disorder, before or as part of the digit sucking program.
A child should not be put on medication for ADHD until they at least have a screening history, looking for possibilities of a sleep problem as the underlying cause. Because if you treat the sleep in the child, then maybe they don't need to be put on stimulants. And a lot of times it's due to a small mouth, malocclusion. That relates also to a respiratory issue. And the child may be having subtle breathing disturbances during sleep. A lot of orofacial pain dentists have gone into dental sleep medicine because they realize by treating the airway, they're helping the patient's TMD symptoms. If you're seeing a headache specialist, you're waking up with headache and your headache specialist hasn't asked you any sleep questions, hasn't screened for sleep issues, then you got to go to another headache specialist or go to a sleep specialist. Botox, I assume, is going to make the apnea worse by decreasing the bruxing phenomena. We definitely have shown that by treating with CPAP, there's improvement in the patient's symptoms and in the bruxing phenomenon itself. I've had patients that have a home sleep study comes back at normal, and then we bring them into the lab and they're severe. You got to realize that what you see depends on the tool you use to look. And a home study can be used to diagnose the condition of sleep apnea. You cannot rule out sleep apnea with a home sleep test.
Dr. Boyd, can you talk about how bruxism can make the occlusion worse?
Swallow, tongue thrust, myofunctional disorders, well, that's what exacerbates malocclusion.
What happens during pregnancy and sleep apnea, the impact it has on the fetus and the mother itself.
It's recognized that preterm birth and small for gestational age, intrauterine growth restriction, those things are known to be associated.
A lot of kids are going to go and have orthodontics done. And when you get the history, you find out that after the orthodontics are done, that's when the bruxing started. And these are individuals that have had retractive orthodontics. I guess the extraction, retraction orthodontics is sort of the standard of care, but really when the standard of care may be putting someone at jeopardy of making their health worse, we have to change what the standard is. I think people need to become much more aware of what's going on in the airway and realize that orthodontics plays a crucial role in the anatomical structures and the volume of the space and how the tongue plays a role, and all that's part of the upper airway. Is not just dental, it's medical.
Dr. Simmons is the founding director of the Sleep Education Consortium. That is a wonderful conference coming up in April that everybody really should attend.
There's so little time spent teaching medical students anything on sleep. So I put together the consortium to meet that need from that deficit in education. And dentists are really well situated to identify patients that have sleep-related breathing disorders because the mouth is part of the airway. And there are dysfunctions of that anatomical region that can be a red flag if there's a bigger problem. If someone is going to be involved in sleep medicine, they really need to understand that it's not all about airway. If you're interested in this topic, you really want to go to one conference that's going to teach you a lot about sleep. This conference has really transformed many clinicians' practices. I hear it all the time.